heel here and the knee. You can do it this way. I like to do it this way because I feel like I can control the femur more. You just have to be careful when you do it this way that you're not compressing, okay? You're not going to weight bear through it. So you're going to just kind of bring her up slowly until you feel R1, R2, and then you can set your grades of movement. So R1 is just a small amplitude, shy of resistance. You okay here? Okay. R2, large amplitude, just shy of the resistance. Grade 3, I'm going to work in and out of that resistance. Okay, large amplitude. And sometimes for this one, I'll have patients move their hands here. Okay, just so it doesn't block them. And then grade 4, going to come staying in the resistance, small amplitude of movement. Okay? Now, because her most painful or comparable sign is way in here, this is where I would work. Okay? Because the others are joint signs, right? It's abnormal movement. She's stiff, she feels it, but she feels it the most here. Okay? So that's where I would prioritize. So let's do it.
You're not distracting when you do this, are you?
No.
You're just moving.
You're stretching the posterior capsule, but I'm not adding a distraction into what I'm doing, but I'm also not compressing. Okay? Okay. So because she's more of a stiff patient, are you okay here? I'm going to just do a grade 3. Large amplitude, working into the resistance, 50% between R1 and R2. So stiff patients, I usually do about a 60-second bout. Still okay? Or feel okay? Tell me if it gets any worse. And what should start happening is it should get better. If it doesn't, I might need to back off and do a grade 2. You okay? And I can feel it starting to give more. It's starting to loosen up. How's the pain? Better? Good. Do you usually do a minute, Jason, for stiff patients? So pain dominant 30-second bout, and you reassess. Okay, so let's reassess and see how. You see how much more flexion she has just from that? How does that feel? Better, same, or worse? Good. Okay, so just that 1 minute bout is effective. Also, when I'm asking my patient how they tolerate it, I don't ever ask an open-ended question. So how does it feel? Because you're going to get a 10-minute answer. Ask them what you want to know. Is it better, same, or worse? Okay? If it's better, I'm going to do another bout of it. I'm not going to get greedy, but I'll probably do one more bout. If it's the same, I'm still going to do another bout. If it's worse, I'm going to back off. I might drop to a grade 2. Okay? So the thing I always teach my students that work under me in the clinic is always ask better, same, or worse. You're going to get the answer you want in a lot less time. Okay? Great, let's do it again. You see how much farther she's getting? Okay. So I'm going to go a little bit into the grade 4. You okay? So I'm okay if it provokes her a little bit because she's a stiffness patient. But I want to make sure that as I keep going, her symptoms aren't worsening. Doing okay?
Yep.
Now she's someone that would really benefit from an inferior glide too, which I'll show you guys. Is that on the sheet? Inferior glide. I'll give you a freebie. It's a really good one.
Longitudinal manipis.
Yeah. Doing okay? Alright, let's reassess. Better, same, or worse? Do you see the difference in her range? Okay. So the quadrant, not only a great assessment technique, but really good for treatment too. quick, easy on you, and the patient will immediately feel the benefit if it's the